So my name is David Siegel. I'm the chief of the myeloma division at the John Theurer Cancer Center in Hackensack, New Jersey. We have a number of clinical trials that are going on with Selinexor in the United States right now. The first one is just single agent Selinexor, and even in very heavily pretreated patients, we're seeing response rates of 20%, and we've had drugs approved with response rates in that kind of range in patients who are not nearly as heavily pretreated. I think that the wider scope of combinations is going to be where we really figure it out, and there are clinical trials going on in combination with Velcade, in combination with Revlimid, in combination with carfilzomib, in combination with pomalidomide, all of which have shown very exciting results. And so I think Selinexor is a very interesting drug. Its mechanism of action is way different than anything else that we've looked at. It is a XPO1 inhibitor. So XPO1 is one of the proteins that makes up the nuclear pore. So cells have a nucleus. That's where all the genetic material is kept. But the outside of the cell, the cytoplasm, is where all the work of the cell gets done. So we have to have communication between the nucleus and the cytoplasm. So messages are sent out. Proteins come into the nucleus that regulate all kinds of things, and so this is sort of a critical junction point. And so Selinexor is the first inhibitor of this XPO1, and that what it does is it prevents some molecules, many molecules, from passing from the nucleus to the cytoplasm, and many molecules from coming in from the cytoplasm to the nucleus. I think the theory is that there are tumor suppressor proteins that cancers try to get rid of. One of the first things that cancers try to do is get rid of all these regulatory molecules that prevent the cell from proliferating, that cause the cell to die, and tumor suppressor proteins are sort of critical in that regulatory process. And what this molecule does is sort of trap those proteins in the nucleus of the cell, so that the levels rise and you get back some of this function. And I think that it's an incredibly exciting process. The other thing that happens is that there are oncoproteins, proteins that are mutated and go out from the nucleus. The messenger RNAs that code for their synthesis go out from the nucleus, and these proteins that cause proliferation, that cause all kinds of other processes to go on that we don't want, can get inhibited as well. So it's a really different kind of target than we were used to in oncology in general and myeloma specifically. And I think while it has been a somewhat difficult molecule from a toxicity perspective, we're starting to understand how to deal with some of these toxicities. And I think the spectrum of activity that we've seen is remarkable. I mean, patients who clearly have no other alternatives, who have responded to this kind of therapy. We have a new definition for unmet need in myeloma, and that's what we call penta-refractory patient, the patient who no longer responds to bortezomib, lenalidomide, pomalidomide, or carfilzomib, and now have added on that we call the quad refractory patient. Now we have the ones who are failing, or the patients aren't failing, the drug is failing, but daratumumab as well. And so we have this population of patients who really have no obvious alternatives, and we've seen very robust response rates. And now there's some early data on combining this molecule with other agents like lenalidomide, like carfilzomib, like Velcade, like pomalidomide, and incredibly, even in patients who are highly refractory to those drugs, when you add Selinexor to it, the responses get reestablished, and the synergy, the combinations are so effective that we can pull back on the doses that we're using, so that the drug is much better tolerated. So I think that this is one of the most exciting things, and I think there'll be second and third generation XPO1 inhibitors and potentially other targets in the nuclear pore. So I'm, while it's not a high-profile drug that people are talking about all the time, I think it's an incredibly exciting drug.